Hi there. I'd like to welcome you to tonight's lecture. As you know, I'm Mark Dushevsky, the director of the Neiswanger Institute for Bioethics and Health Policy. And we have tonight a speaker who really requires no introduction, but I wouldn't pass up this opportunity for anything in the world, so I am going to give him an intro. This is Haynes Johnson, as you know, who is currently a professor and he's holder of the Knight Chair in the College of Journalism at the University of Maryland. Of course, he's better known to most of us as a former Pulitzer Prize-winning journalist with the Washington Post and the Washington Star. He's considered one of the nation's leading political journalists. He is a television commentator who has appeared frequently on the PBS TV programs Washington Week in Review and the NewsHour with Jim Lehrer. He's the author of 11 books, including 3 national bestsellers. He authored with David Broder The System, which came out in 1996, a detailed account of the political turmoil that surrounded and ultimately derailed the effort of the Clinton administration to pass comprehensive health care reform. And it seemed appropriate to me that during National Cover the Uninsured Week, which is being recognized this week, that we should ask Mr. Johnson to come here and share his reflections on the political prospects for health care reform in the United States, as we seem to be getting ready for another attempt to pass comprehensive reform. And so please give a warm welcome to Mr. Haynes Johnson.
Thank you. Thanks, Mark. I'm going to start from over here, but I may move around when I speak because I got some notes here. But this is going to be very personal, and I hope we can have a discussion and a dialogue about events, particularly healthcare, but more than that, who we are as a country and what our values are and what we believe in and how we achieve change in this fragmented society of ours. And that's the reason that I write, and that's the reason that Dave Broder and I did this book on the healthcare effort of the Clintons 10 years ago. And I want to talk to you about that in the beginning, but first, recently I received one of these things from Google that flashed into my computer and said it was from Slate, by the editor of Slate, and it was an interview with Ron Wyden, Senator Wyden, who was about to introduce a comprehensive health care reform plan. And this article, I hadn't seen it, I just wanted to cite it. It goes in why he did it, describes what it was all about. And then I found this item in here. He said in the Slate editor, J.F. Weisberg, noted with admiration that Senator Wyden, author of an elaborate new market-based health care reform bill, was so determined to, quote, learn from previous Democratic mistakes, end quote, that he read, quote, read The System, Haynes Johnson and David Broder's massive tome on the failure of the Clinton health care reform, no less than 5 times. And then he went on and drafted his bill. I take no credit for the bill or what he did, but I was very pleased that somebody remembered that we tried to look at the process then and that it has relevance to where we are today. And that's what I want to talk about. But it's not just about healthcare reform, because when we talk about all the variety of plans before the country now, again, we're talking about our political system and who we are, what we believe in, and how we achieve change. That's what the political system is. It failed catastrophically in the Clinton health care reform in a way that made it almost impossible for a decade for anybody to bring forward anything remotely possible of passing. In fact, there was no interest in it at all. When Dave Broder and I, who's from Chicago, as you probably know, started the book, the idea was, in my megalomania, I wanted to write a series of books on the working of the American political system, how it really works, not the way reporters write about it, what it's like to be inside a governor's office and all the pressure with the lobbyists and the legislators, what it's like to be in a mayor's office and out in the communities and the wards and it really works or doesn't work, what it's like to be in Washington where we've covered for God knows how many years and all that. And we actually signed a contract and we were going to do 3 books. There would be the system at the state level, at the local level, and then finally at the federal level. We actually took the money on it too, and suddenly decided that after looking at it, we'd never live to finish the project, and we'd probably never speak to each other again when we did. So we then began searching around for a way to try to tell the story of the system on an issue that affects every American and has great moment. Bill Clinton had just been elected president, and he was making health care reform the central domestic reform of his administration. And Dave and I retooled and said, that's the book we want to write. We want to follow that process as it goes forward from the beginning and to whatever happens on it. The prospects for health care reform then, and I want to bring it up to now, was the best in decades. Health care reform, a real universal health care reform, has been on the table of American life since Theodore Roosevelt in 1912 talked about giving health care to all people. Woodrow Wilson talked about it also. Franklin Roosevelt in the Depression was a believer in that, and in fact, when he introduced the Social Security bill in 1935-36, half of it was to be universal health care. Well, they didn't call it that term, but it was to be health care to provide an underpinning for Americans in need who had none at all. And he dropped the health care reform provision out of Social Security because shrewd political operative and canny politician that he was, and he had good advisors, and they said, it doesn't have a prayer if you put health care in because the American Medical Association will kill it as socialized medicine. So they dropped it, took it off the table, and Social Security came in. There was an effort made in World War II in 1943, the first bill to actually introduce what we now call universal health care, and it got nowhere. The war was obviously, and the politics nowhere. When Harry Truman made it one of his centerpieces of his campaign in '48. He won the election, but he didn't win health care reform. And then you went on. And Jack Kennedy similarly had ideas, which became Medicare later on, and it didn't see fruition in his 2 years in the White House. And it was only when Lyndon Johnson came in with the great electoral victory coming after Kennedy in '64, he was able to pass a whole series of things in the Great Society. I'm giving you this background because it really, to understand the difficulties, and I want to get into that so we can have a discussion about it. So you went through that process, and Jimmy Carter, similarly, he was going to have that. We've made it a central piece. If you go back and look at the campaign rhetoric, what he said he was going to do and was for, genuinely, not cynically, they really believed in the need to have this missing element in the American system to provide protection for our citizens, those with and those without means, and so forth. And of course, it went nowhere with Carter, and then it just dropped off the table until Clinton came in, basically, and then Clinton. And when Clinton became president, there was a unique opportunity to pass some form of a real health care reform bill. And I say that because the conditions in the country had changed. There were then 38 million Americans, 38, remember the figure, that had no health insurance at all, and it was rising. The numbers were rising. The system, economics were difficult. There were debts. There were difficulties between public and private resources in the country. And there was a prospect. Clinton became the first Democratic president since going back to Lyndon Johnson and Jimmy Carter and so forth that really had some power. He had both houses of Congress. All the committee chairmen were devoted to health care, they said. They could build and form and craft legislation to bring it before the country. And more than that, there was a strong body at that moment of Republican leaders in the House and the Senate, particularly in the Senate, who were devoted to doing something about health care. Most notably, Bob Dole, who had been the majority leader of the Senate, was an ardent supporter of health care for good reasons. His wounds in World War II in Italy, if you know Bob Dole or you see him, He still walks like this. His arm was shattered. He almost died. And he went through a series of dreadful hospitalizations coming back. And out of that process, he married a nurse. Didn't last too long, but that's something else. But that there was a genuine feeling about that. And there were other people among the Republican side at the time. Someone that I got to know and admire enormously was John Chafee of Rhode Island, who I think was one of the greatest people I've known in all the years that I've written about American life and politics. Chafee was a senator from Rhode Island, a Republican, he was Secretary of the Navy at one point. Before that, he was a Marine in Korea. People who served with him worshiped the ground he worked on. He was brave and he was honorable and so forth, and he cared. He had a sense of public service and public spirit. And so you started with that and a willingness to cooperate on this window of opportunity because there was a need for it. And the politics seemed right. And it was at that point that we started trying to track this fateful story, as it turned out to be fateful, because that became this book, The System. And we went around to all the players, as we call them, who were going to be involved in the story and enlisted their cooperation. The president, Bill Clinton, his wife, Hillary, all the people in the cabinet who would be involved in any way with the process, the leaders of Congress, the speakers of the House, the Speaker of the House, Republican and minority leaders, and the heads of all the operative committees. And we told them that we're going to follow this story. We want to come around and talk to you. And we pledged not to write a single thing about make public what you tell us until it's all over. Nobody knows what's going to happen until it's all over. And so we started the process of those interviews on tape, all tape recorded. In my office at home, I'm drowning in these goddamn manuscripts. And, I don't know what to do with them, but I'll give them away sometime. But they were just one after the other. And this went on for more than 3 years. We also took, as a part of the original idea, just so you have the background for this project, we took the largest local entity in the United States, Los Angeles County. And I did most of those interviews there and spent, again, off and on over 3 years, going there, talking to the doctors, going to the health clinics, going to the public and private. Cedars, Sinai, the hospital in Hollywood. I'll never forget that walking in there, you see people with leopard coats and Bentleys out front, and all the stars were going there, and they had the best care, you can be sure. It was great. And then you drive down the highway to Watts, and you saw something different. And you saw the Los Angeles County Hospital, which was the largest public such facility in the country at the time. I don't know if it is or not. And the disparity between those two pictures is something that haunts me to this day. I would come down, drive in a rented car down from Cedars and and pull up in front of the county, big, huge facility, and you almost had to step over bodies to get in. Literally, they'd be lined up, couldn't get in. Then they had shootings. They had, not the way we have now at airports, but they had security all over the place. And it was really long, long lines of people who couldn't get service. And the service was, the hospital workers were devoted but strained and stressed, and the revenues were cut. And that was a part of the story we told, or tried to tell. And then we took one state that the Clintons were making as a model. It was Minnesota, by a governor who was then a Republican. They were going to do health care reform, and that was the model. So we followed this, we tracked this story from the first time that Clinton became in the office. And God knows how many conversations we had with all of them over and over and over. And I was telling Mark just a few minutes ago when we met, one of the things that's interesting, of no particular relevance maybe to what we're going to talk about here, when you do these kinds of long-term projects and interviews with people, the whole idea is, do they trust you and do you trust them? Are they going to be straight with you? Can you count on what they're saying is real? And the idea, when they all cooperate, they all want to be, being political figures, they want to be the hero of the story. They figured it's in their interest. They're going to look, I brought health care to America. Or in the case of Newt Gingrich, I stopped it, because I saw from the beginning this was a liberal plan and it will guarantee the Democratic control for 50. He told us this. And all this, just absolutely nakedly. And I was determined a year before it. I figured this was the next best move of the left to bring us universal health care. And I'm going to kill that bastard. And that's what he did, too, as a matter of fact. So they all had the idea that they would come out somehow as the victors. But when you do these kind of tape-recorded interviews, I don't know if any of you are psychiatrists. My sister's a doctor in New York, so I have no medical knowledge. So I say this by way of background. But it's like psychiatric transference. When you talk to someone after a while and they can't take away their words. And as it goes on, all of a sudden they want you, the story keeps changing, and they're no longer the hero, maybe the loser, and they want you to know. They would call you up and say, I want to see you, and so forth. And I recall to Mark that when this thing was all coming to a tragic, I think, end, blowing apart after 3.5 years, I got a call from John Chafee's aide and said he wants to see Haynes. That's me. And I said, I just saw him 2 days ago. He's got to see you. And so we met that night after the Senate session in the Metropolitan Club, a very fancy, exclusive place. We went to a back table, and just the two of us, and leaned over, there was a candle, and he looked at me, he said, you've become my psychiatrist. Because they all wanted, it really was a fascinating thing. That was true of the people who were the committee chairman and the rest and so forth. So it totally failed. It led to the Gingrich Revolution. It was a single fact that led to the regaining of control by the Republicans for the first time in 40 years of the Congress of the United States. And it set in motion what we're still playing off now more than a decade later. So it did have consequences, and it was so profound and decisive a defeat that nobody has tried to do it again until now. That's the kind of background. I'm giving you a short-term synopsis of what happened, what took place. The reality is more complicated because the story never ended. The situation that we described in 1993, when Clinton came into office, where the United States faced 38 million Americans who had no health care insurance at all, is now 48 million. It was 37 rather. Now it's 48 million. And the range of changes and across the board in every level has gotten worse as more and more companies are restructuring, laying off workers, cutting benefits. You're familiar with all this. That had happened then too. That was part of the opportunity to forge some sort of bipartisan consensus and create some kind of plan. But even now, it's just exploding. It's globalization, it's the markets, the anxiety, it's the rising debts. Yes, it's about Iraq too. Where's the money coming from? How do we separate this from that? How do we allocate our treasures? And how do we set our priorities in this democratic small d society? All those are now even more at play than they were then. And so we are now approaching, and what I want to first of all explain to you why, if I can, why it failed. There were amazingly, in retrospect, blunders that took place. Clinton was remarkable, the president. At the end, we had a final session with him in the Oval Office, and he took all the blame on himself. He tried to do too much. I recognized that I was responsible for it. I shouldn't have let Hillary be in that position because she became a target. And although she certainly has great knowledge and she was terrific, but it made her into a target. The idea that we tried to do too much in other areas, other fronts in the administration. And he went through all these just remarkable candor. What mistakes were made on his part and his people's part. That's true, but that's not the whole story by any means. Because the reason it failed basically is because, number one, that plan, the Hillary plan, as I quote you what Ron Wyden said in his 5 readings of this massive tome, he said that, somewhere he says in here that, well, oh yes, he said the figures were that the Hillary plan was like 1,500 pages long. I have the figure there. His bill is 163 pages. And his idea was basically more simple and not as complicated to understand. Wyden is a very serious player. This guy is, I don't know whether his plan will pass or whatever it will be, but he was trying to make the sense out of it, not to have it so complicated and so easy to parody as it happened, and to ensure that there was going to be, the idea of the country would be that it would not be just socialized medicine or this or that, or government take care of your facilities and so forth, but that it would be a plan for everybody. And what Wyden's plan says, it abolishes, in effect, the employer system of paying, which started during World War II. It had nothing to do with the merits of how you bring health care. Because of World War II, you had limits on pay raises because of the war. And so the employers started giving raises for people. They started paying them in benefits and health. And that's how it started and began to explode and change and so forth. So you had that process. But beyond that, the whole complicated nature of when the Clintons tried to explain it was so easy to parody, so complicated. You couldn't understand it, the language, et cetera, and it was easily parodied. And furthermore, what Broder and I learned, and we've been around a long time. I said to my friends earlier, I've been around since Lincoln, but David maybe longer, I don't know. But it really, we thought we knew a great deal about American politics and lobbying. We were naive, babes in the wood when it came to how it really works. Because every week, a block from the White House would gather in a room around a long table the leaders, or the heads, the lobbyists of all the major institutions, the manufacturers, the hospitals, the drug manufacturers, and they would plot strategies of how to kill the Clinton plan. And it worked. And they would take that material, and they started with the Harry and Louise ads. You may not know about the idea that it was very clever. You're sitting and here you are in your living room, and I'm Harry and you're Louise, and we're worried about these health care bills. We've got to do something. There has to be some way to do it better. And so they say, yes, but this is not the answer. There's got to be another way. And that was the opening, and that ran over and over again. It was people said, yeah, that's right. This is so complicated. It's not going to work. It's not going to affect us. It's not good for us. And it scared people, and also allowed them to demonize and frighten the people involved. That was the short term of what happened. We've seen the same kind of techniques played off in all of our campaigns, not just about health care sense. You frighten, you use fear as a weapon to exploit an issue to gain effectiveness. They all do it. It's not just the Republicans and the neocons and the rest. They all do it. They have their operatives and their ads and so forth, and they try to put on the best flight and to scare you. If you do this, you're going to wind up worse off than you are. And that was a brilliant success, but it didn't solve the problem of what to do about health care reform. And so it has slumbered, but never really stopped in the decade since then until now. I have to tell you that I really do believe that this is the best opportunity for real health care reform that we've had, even more so than then, because the nature of the problems confronting the United States have changed. People recognize it. Not only that there are more people that are without health care, more people inadequate health care, more people, more haves, have-nots, more disparate connections in the society. That's true. But it's also all these other things that have been happening. The changing job structure. I've worked in the newspaper business for my life, and my father before me, we were happily the only father and son Pulitzer Prize winners, and I'm glad he's not around to see the newspaper business, how bad it is, and how they're laying off. Here in Chicago, I think they laid off 150 today or something like that, and it's happening all over the place. The Washington Post, which was the most prosperous of all the newspapers, has had 2 buyouts in the last 4 years. And the New York Times is today they had their board meeting, they're being attacked to divest the family ownership so they can sell the paper off as the Tribune was sold to private owners and for profit. So there's a whole change in the economic environment of jobs and job security, and that's true of everybody in the country. Nobody is immune. You don't work at General Motors for the rest of your life. They may not be at General Motors anymore. You don't work in the Ford or whatever it may be because for a lifetime, and the benefits get cut back, and the costs go up. All of these things you're familiar with are the backdrop. So here comes this election, and here's what I really want to. Clinton failed for a lot of reasons. The enemies, the ability, the uses, the ability of the press, by the way, one of the great failures of the health care reform. When it started, I had absolute assurance, whether it would pass or not, there was no question in my mind whatever, that there would be, out of all of the hearings and all of the plans up before the Congress then, they would get a bill and it would be debated and it might go up or down. But there was no question. The Democrats controlled the committees. They had the power. They had both houses of Congress. They said they were for it. They had the President of the United States, etc. They didn't get a single bill. Not one ever came to a vote on any committee, and none of it came to the floor. It was such a catastrophic failure of the Democratic Party, number one. I remember Hubert Humphrey telling me when he came back, he was dying of cancer, said, you have to understand something about Congress and the presidency, Haynes. He said, he was then again a senator. He said, we'll be here forever. Presidents come and go. Well, that's what the Democrats thought. They would be in control, so it didn't matter if they didn't pass it this time, they can pass it the next time. Because the idea that they would lose their ability to set the agenda, to pass the legislation was incomprehensible, and the shock of the Gingrich 94 turnabout and defeat and takeover of Congress transformed the whole political equation and sent the Democrats reeling and backward. The other thing that Clinton, smart as he is, and I have known him since he was 19, when I was doing a biography of Bill Fulbright on the Vietnam War. Became like a father to me, and the closest male aside from my own father. And they brought this fat-faced kid into the office one day and said, want you to meet somebody has just joined our staff, has great confidence, great promise. He's at Georgetown University and so forth. Bill Clinton, and he was just the way he is now. A little chubbier, so voluble, schmoozing, talking, all that. Everybody liked him, great promise. And nobody had been more skilled. He was there at the time of Martin Luther King, the murders, the civil rights disturbances, the Vietnam War calamities. And Fulbright was leading the charge against changing the war. And then he goes off to Oxford, as you know. I'm not going to give all that. With all of his smarts about politics, he fundamentally misread out of arrogance. His election, he only got 43% of the votes. That's not a winning majority to build a constituency. Lyndon Johnson got 64% of the votes in the landslide of 1964 and swept the whole country with huge margins in the House and Senate. So you could really get things through. And that was the fundamental mistake that Bill didn't read, that he was so sure he was smart, and he is smart, and he would be able to overcome these things by selling ability, the climate was right, and so forth. So you have to have a winning majority and across the board, and you have to also do what they failed to do. You've got to reach out to your opponents. After it was over, I had a number of sessions with people at the White House, and then later for a reading like this of why did it fail. I said, you should have hugged Bob Dole every day. Grabbed him, kissed him, told him how great he was. And don't let him get away. Because he wanted to be president too, and he thought he could, and he did run, but the opportunity was there then. And instead they stiffed the Republicans, drove him away, didn't meet with him. They were secretive. They had this total secretive policy that they wouldn't even let people in. The press couldn't interview and so forth. And it was just stupid. And then the press did, as usual, a terrible job. The complicated story. They didn't have the facts. And they treated it like a political, as you're seeing in campaigns. Who's winning and who's losing? What are the polls saying? Rather than trying to explain what this really means. What are the stakes? What are the plans? How would it affect you? And what's good or bad about it? And they didn't do, there was some good journalism, but also some terrible. And the same thing we've seen on the war in Iraq. The same kinds of things of not challenging, holding people accountable, raising questions about the issues, and then trying to present it to the public. Much better now, but for a long time it wasn't there. So for a lot of these reasons, this thing failed. And that's all the backdrop for where we are now. And now we're approaching what I really genuinely believe to be the most important election in my lifetime, the presidency in next year. And I say that not hyperbolically or to build it up, but because I don't recall a time ever where there have been so many, the stakes are so vast before the country. And they're all related. You can't separate out Iraq from health care, domestic reform, or debts. You can't separate out political will from the ability to decide how we repair the damage to America, America's standing in the world, America's prestige, and how we sort of allocate our resources. And do we believe that we are, in fact, what we say in all our declarations, that we're here to make a difference in people's lives, if that's what we are. And so all of these issues now, global warming, globalization, the change in the economy, the restructuring of the workplace, the rising health care costs, the incredible baby boom debts that are hovering right over everybody in this room. Not me, I get my Social Security now. I'm okay, thanks very much. But I'm serious that this is they're all here, and you can't separate out anyone. And the whole question is, in our society, is it takes leadership to mobilize the country. It's got to be consistent, it's got to be direct, it's got to be persuasive, it's got to be tireless, and you can't take on too many things on the plate. You've got to decide on what are your priorities in the time you have to exercise power and political authority. That means engaging the public in something. And I came to Washington in '57, and I have watched every president since Eisenhower. And looking back on the people that made a difference, really made a difference, the one that is the most striking to me, most memorable, and I knew quite well because I used to record on civil rights in the South and Selma and so forth, was Martin Luther King. I spent a great deal of time with King, and just before he died, as a matter of fact, and was on that night, I flew down to Memphis, and the blood was still coming down the balcony at the Lorraine Motel. What King did is the role of an old-fashioned political leader. Not a preacher. Yes, he was a preacher. But what he did was wring the conscience of the country and ask Americans to remember what they say they believe in and challenge them to live up to it. The character of your it's not the color of your skin, but it's the content of your character. That's what matters. And do we believe that all men are created equal? And we try to strive to do that. And he didn't say it cheaply or phonily. He rang the bell. They had this observances just recently in Selma, where I spent a year almost during that period covering that time, and in the church where King used to preach, and the hair to go up on your back because the emotion that came out of those sessions. And people were there storming mobs outside, ready to bash, and they did kill people. And the king would speak in it the same way. It was not revolutionary. It was not French. They're going to cut off their heads and put them on spikes. It was asking people to believe in democracy, that it can make a difference. And he prevailed. He did make a difference. And he changed the country in a way that is for the better. And I know that there's a lot of cynicism, or doubt, and distrust about the workings of our political system, for good reasons, for all kinds of reasons. But I also would offer to you that when I look back, I did my graduate work in American history at Madison a long time ago. And the reason I went into journalism, I wanted to write about the country. I wanted to try to write who we are and how we change and how we make progress or we don't. And that was the story I enlisted up to try to tell in a lifetime of work. And if you look back at where we were 50 years ago, the time I came there now, I see women in the audience today, women in my seminars, both here and Princeton and places like that, and this majority of women. And I know you don't take it for granted, but believe me, when my sister was a medical doctor, came out of Radcliffe in '55, she was the only female member of her medical class. And it was not fun for her. They did not want her in that class. It was quite a difficult period. And when I see the changes that we have made despite Vietnam, despite Watergate, despite scandals, despite tragedies, assassinations and all that, and I actually witnessed those, was there when they happened to most of these events, we also made enormous progress. We just take it for granted. We have expanded rights for Americans, for women, for gays, for Latinos, for handicapped Americans. We've made enormous strides, and despite the Supreme Court rulings, we are more liberal in terms of our opportunities than we were. And I'm not just making a speech to sound pompous about, it's just a fact. And we sort of take it for granted that despite all the difficulties, we did make progress at that time. And now we're up to the great test of our times. In this next election, and I really mean this, the candidates who are, we don't know what's going to happen, who are before the country, at this point, the Republicans have opted out of the health care debate, essentially. And you have the Democrats offering. Hillary Clinton gave a speech, said health care is the #1 issue before America. And she knows more about that. Believe me, whatever you think about Hillary, she was formidable in gathering the facts when she went through that first example. And she was battered. She went into not a deep depression medical, but she was just not Bill. Bill was unquenchable. We're going to get over it and so forth. But it took a long time coming back from that experience, and she's thought about it a lot. I'm not making a speech for her here. Obama has, and I know he's a Chicago figure, and I think he's the most interesting, eloquent figure I've seen on the stage in a long time. I have great doubts about whether he's up to be president or not, for what it's worth. But one thing that really shocked me about Obama, they had a debate in Las Vegas of all the Democratic candidates, specifically on health care. It was last month, I guess. Hillary had her plan, John Edwards had his plan, and he's a passionate advocate for some kind of form, and then Obama was there, and he said he's for health. He had no plan, none. You figure it out. I mean, how can you go there and not say where he's going to? And so, it's an act in progress. We'll see what happens as he goes forward. So what happens with this? But there is, out of this is, I was saying to Mark earlier, before I came to this room, that what Obama has tapped into is a larger reflection of where the country is. A hunger for something better, a hunger for change, a hunger to make a difference, to be better, to be up to where we are. And there are already in this very accelerated campaign process that now is insane, it goes on for 2 years, Obama has drawn 10,000, 15,000 people for visitors to campaign rallies, where if you were 4 years ago, it might have been 100 people. That's really extraordinary. And this is true across the country. There is a hunger, and there's also a willingness to look carefully at it, but there's also a strong sense of, show me, prove to me. We've been disappointed before, it's been hard, and you don't want to put your faith and be disabused in the process. But believe me, at this moment, there is enormous movement to change. I think, I'm not going to predict what's going to happen, or certainly not who's going to be the nominees or what the programs they will produce. I do think healthcare is and will be the number one domestic issue. And it's directly tied, what makes it complicated, the war in Iraq. How we deal with the aftermath of Iraq. You can't separate that out from anything. The costs of government, the feelings of public service. I hope I'm right about this, and this may be the old Madison roots, the progressive period and that period, which was a great thing that made a difference in this country, the La Follettes and all that, a great admirer of what they did and for public service. And we desperately need to reignite the feeling that we have to have the best public servants. And that means not just medical practitioners, it means people who know Farsi, people who know the cultures of the Middle East and India, people who can serve under great distress, military people who have backgrounds, and we do have, General Petraeus is a very interesting, modern kind of figure, West Pointer, but he got a PhD at Princeton, reads histories and so forth. He may be a great flop on the surge, but there's a different quality of these. We need more of these kinds of people. We need to invest in a rebirth, if you can, if you will, of making the country better. And it's not just a naive wish. It's a practical thing. It's a practical thing. That's how you achieve something. Politics can make a difference, despite all our disappointments and disillusionment. And so I think I'm actually optimistic with crossed fingers about the outcome of where we are. Of the plans that I've seen so far and looked at, and there's going to be, there is a difference among the groups opposed to health care reform. There is a feeling that the age of the employer benefits for underwriting health is over. They're not going to be able to do it. It's already happened. So therefore, what does that mean? There's a practical effect of this. Something has to replace it. You can't have people out in the streets dying, although it happens in some areas. And you need people that have this sense of public spirit and making a difference. So I think that all these things are now boiling up at a really remarkable moment in our history. And it requires doing what King did, igniting the conscience of the country and deciding, asking people to sign up, not to solve everything, but to see if we can make some differences that are in our interest. And they may be selfish interests, but they're in our interest to protect ourselves. The American political system is the most complicated in the world. It was designed to make things difficult. Everybody who, if you go back and read the actual documents, they all debated, those young men, no women at the time. They all had the sense, yes, they knew Plato and they leavened their stuff with all kinds of analogies of past historians and the rest, and and it was interesting to read and so forth. But they crafted this society with one thing in mind. They didn't want a king. They didn't want an emperor. They didn't want a czar. They wanted to create a system where you wouldn't be dictated to, and so they made it very difficult to have things get done. So the House and the Senate check each other. The White House, the Supreme Court across the street, and then they gave in to the people outside, to the press, this unlimited, really what people think is a shocking responsibility, the right to be wrong and challenge and bring unpleasant truths and often untruths into your homes. But they gave it on the idea that if you do that, you might avoid the mistakes that history has always had in the past. That's the system. It still operates the same way. And the challenge is, do we understand that, and can we overcome it? Can we forge? And it's happened in the past. It happened in times of crisis. World War II, the aftermath of the Civil War, the ending of segregation, women's rights, the whole process. None of it happened immediately. It happened over time, but it was a steady progress. I think now we're at the point where we've reached the point where we're really, I hate this cliche, we're at a crossroads. We got to decide who we are and what we want, and that comes back to a political judgment, not a policy judgment. The one mistake that the Clinton people, more than all the rest, made, they had the belief that if you studied all of the health care problems and all of the arcane difficulties, and you really studied them and you put them all in, that you would be on the path to making a solution. Ira Magaziner was the architect for the health care plan for the Clintons. Very smart guy, very brainy, and I used to go talk to him once a week over in the EOB office, across from the White House. And he would tell me over and over again, we studied this, and he would point around the back. He said, here you have, look at this, Haynes. See all these black loose-leaf books? We've studied everything. We got all these solutions. It's great. And not a one of them got through because they didn't have the politics. You got to marry the politics with the policy. And if you don't have the politics, that means the leadership and the ability to reach people, you're not going to get anything done on any question. And so the test is to marry the two. And that's a hell of a test for leaders, but that's what we're supposed to pay them for and seek them and celebrate them when they deserve it or not. I think I've probably talked too long here, Mark, but I want to close and I want to have some questions. I do a lot of reading and I like to take books to bed. And I found something that really struck me that I hadn't seen before some time ago. And it was an account, you know, in the 19th century, all these people came to this country to look at the democratic experiment and to figure out where we were going in this untamed, unkempt, raw, violent society that is America. Tocqueville in 1830s, Dickens came in 1848, did great works, wonderful. Dickens was a great reporter before he was a novelist, by the way. And Lord Bryce came and wrote 2 big books on the American system. And they were all very interesting. And they really examined us and detected us and what we were and what we weren't. And then at the very end of the century, the greatest scientist of his day, Sir Thomas Huxley, came here, the father of Aldous Huxley, the writer. And he did the same thing. He toured the country. He went all over. Now the industrial age was being born. And wherever he went in America, there was great clash of sound and steam and spanning the prairies and girders growing up. And the American age was being born. And he went everywhere. And then he got on a boat to go back to Great Britain. And I was fascinated. The reporters of his day were no less stupid than mine. They just didn't have cameras to stick in his face or microphones. And they peppered him with a lot of stupid questions. They said, Sir Thomas, aren't you impressed with how big we are? And aren't you impressed with how rich we are? And aren't you impressed with all the material possessions we have? And he fixed them with an icy stare and he said, no, I am not in the slightest impressed with your size or your material possessions. The thing that I would say to you Americans is, your test is, what do you want to do with all the great things you have? And I offered that to our candidates. Let's use it. Let's find out. And let's decide it's time to make a difference again. And I have to close. I wasn't going to do this, but I am going to do it. I had to meet with a group of office holders and talk about the campaign last night in Montgomery County. About 200 people in the room. And as I pulled up, listening to NPR in my car, I heard what just still stuns me, the news that David Halberstam had died in an automobile crash. And we were very, very close, extremely close. We were competitors. We knew each other for 45 years, covered the same kind of things. And I actually wrote 14 books, not 11. David wrote 20. And every time I took out a new book, I say, now I wonder what David's going to do. But he was not a hot dog, not one of these arrogant guys. And he was off doing his thing to interview, one more interview for a new book on a football game, Y.A. Tittle the Great, and he died in a crash. And I thought, what I told these political people, that the whole idea of people like Halberstam, as bad as the press is and as bad as our politics is, that there are people like that and like you who do it because they want to make a difference. And I really mean, that may seem naive, but I really mean it. That's what you go it for. You do it because you want to make a difference. So if we're going to decide what are all the great things we have, I think it would be nice to say what we can do to make a difference. Thank you. I'm going to sit down here and take questions from you.